As a pediatrician specializing in infectious diseases, I can tell you I have seen flu, and I have seen the devastation of what flu illness can cause and its complications. These include, just to mention a few, pneumonia, dehydration, and even worsening of the child's underlying medical condition. This past winter, I remember standing next to a mother of a 9-month-old. The child had been admitted and was diagnosed as having flu. As the child had more difficulty breathing, was transferred to the intensive care unit and was soon placed on a ventilator to help the child breathe. The child remained on the ventilator for 7 days and then required several more weeks of hospitalization. The mother looked at me during that first week while her child was sedated and on the breathing machine and said, "You mean I could have prevented this?" This mother did not believe in vaccinating because she felt that the flu vaccine was not effective and she was concerned about vaccine safety. We know that flu complications can lead to death, and unfortunately, recently there was a pediatric flu-related death in a 4-year-old child who happened to have an underlying health condition. As you've heard, this past season, there were 135 pediatric deaths due to the flu. And even though it was a moderate flu season, and we noticed, and you've heard before, and I think we need to drive this point home, and that is that even healthy children who do not have chronic illness, are suffering the effects and complications of flu. But we know that it doesn't need to be this way. In a recent study that was published in a journal called Pediatrics, it showed that flu vaccination can significantly reduce a child's risk of dying from flu. Trust me, a shot is certainly worth the danger of possibly getting flu, and especially flu-related complications. I mean, it's devastating in a child who has a chronic condition, and you can believe it's just as devastating if you have a healthy child one day and the next day your child is dying in an intensive care unit from flu, which is totally preventable.